So this is the Pentagram, and we'll use this. It's also called a Topography, so you'll hear it referred to as those two things. First thing we'll do is we'll take off this cover here, and once again, we'll put it in the cabinet. So we'll try to fold it real nicely. It's okay. And then put it in here. You just put it anywhere. It's not in a particular place for it. And you'll sit back down. This you're all doing before the patient gets in the room. So then you'll turn on the computer here with this power button, and you'll also turn on the Pentagram itself here with this little black switch. You'll hear it flip, and you'll see that the green light is on. That means it's on. Green light right there. There you go. It's important to mention that the Pentagram can get really hot, so make sure that after you're done with it, you're turning it off. And that means after you've shown Dr. Johnson the results as well. So we'll let the computer start up. And we'll hit Pentagram, just this application on the left here. So now we can search for a patient. So we'll go ahead and search for an existing patient, and we'll do that by hitting search. And you see here that we have some patients listed. We'll go ahead and do MJ test. So we have him selected, and we'll hit Pentagram. You see it's still selected here, and it's pulling up the Pentagram, it's booting the Pentagram. You might get a few error messages about service, but that's okay, you just hit okay. You didn't get one this time, I don't think, at least not yet. So we're here on the patient's specific page. We'll go to examination and then scan. And so now the Pentagram is on and ready to take a scan. We will wipe off the chin and forehead red. So at this point, you could bring the patient in the room, or you would even do that before you hit scan. But you'll go ahead and wipe off the forehead rest and the chin rest. And then the patient will sit forward. And if you need to raise the table at all, it's right here. Right, and once again, you'll have glasses off for this, so if the patient's wearing glasses or a hat or anything, probably have them take it off. And so, is that comfortable for you, or do you want me to raise it or lower a little bit?
That's fine.
That's fine? Okay. So the patient's good. First step for the Pentagram is you'll look over to the side, and you want that blue line to be centered on the patient's eyeball. So since this is essentially going to measure what the surface of the cornea looks like, you want it to be on the cornea. So that looks like it's pretty centered on her eyeball. So I'm going to go ahead and come back over here, and you can see that I did an okay job at that, since I can see that red dot and also her, iris, pupil, everything like that. Or this is her pupil. You can see all that, so I'm not starting from scratch here. So with this machine, basically going in and out is going to, similarly to the IOL, it's going to move this red dot forward and backward. Twisting it is going to raise it up and down, and moving it left to right is going to adjust the other axis here. So it tells you directions. It's a little hard to follow because these don't align with these directions. You just do the best you can following those directions. So this already looks pretty good. We want that red dot on the red line, and then we want to get that yellow crosshair aligned with the red crosshairs. So I'm going to follow what the machine's telling me to do. I'm going to twist a little bit, and I can see that it's moving it here. So that looks pretty good to me. And so I got a good measurement, so it's going to go ahead and take the measurement for me. I don't have to hit anything. If she was aligned and it wasn't taking a measurement, you would just hit enter here in order to take that measurement. So it says data gaps right here. This is where you'll see any possible errors that happened. So since that has an error, it doesn't just say okay on a white background. We're going to have to take the scan again. So I'll go examination, scan, and we'll go ahead and try this again. And we'll go move it here forward, and now we're going to move it. There we go. Alright, so just a bit more here, and a bit more here. So that looks pretty good to me. I'm going to go ahead, once I pull it back a hair, so it's going to take another measurement. It'll ask the patient not to blink And sometimes you'll get error messages related to air coming up through the mask. So if that happens, don't worry about it. Looks like we have data gaps again, so we'll take another one. I'm so sorry, Angela. I'm so sorry. Okay. We'll try it one more time. So she'll sit forward, and we're just going to follow these directions. Going to move it around just a bit. Just to make sure everything looks good. I'm going to take another measurement. See if that works. Come on. Okay. So, yay. That one's done. We don't have to worry about it anymore because this right here says okay on a white background. So, for the other eye, what we'll do is we will hit examination, scan. We're going to move it over, then hit examination, scan. And this looks pretty good already because it's similar to her other eye. We're just going to move that back so that the red dot is aligned closer to that red line. And we'll just move this a little bit. There we go. We're going to take another measurement. Don't blink, don't blink, don't blink, don't blink. If the patient blinks, then typically that'll be a bad measurement. And that one says okay. So the patient can sit back and no longer has to look at blue light. And so now the scan is done. We'll keep the machine on and you bring Dr. Johnson into the room. You'll hit examination load rather than scan. And so you can see all the scans that we did. Now we know that these two scans for the right eye are not good because it just happened. We remember it. If you can't remember, typically it's the last one before you switch. So we'll go right eye and hit OK. So that brings up that scan for the right eye. We don't like this view though, so we're actually going to go to display 4 maps refractive. That's the map or display that Dr. Johnson usually uses. So this is the right eye, and then you don't have to change that display again. You can just load the other scan and it should come up in the same format. So there we go. And that's the topography. So then once you're done, Dr. Johnson's looked at the scans, you have no more patients who need the topography. Then what you'll do is you'll turn off the Pentagram right here, and then you'll turn off the computer.
Oh, don't turn it off.
No, we're not going to turn off the computer.
No, 'cause